Dr. Diana Barnard. I'm a family medicine doctor, and I have additional training and board certification in hospice and palliative medicine. My many years of practice has shown me that we need as many tools as possible to help people who are suffering from terminal illnesses. We must be humble and listen deeply to their needs at this most tender time of life. Since 2013, when Act 39 was adopted, I have been able to offer medical aid in dying services to Vermont patients who are terminally ill and who want to have this option. I have not been able to provide the same option to my patients from New York State because Vermont's law makes medical aid in dying available only to Vermont residents. I believe that it is my responsibility to help bring the patient's voice to the table. In August of this year, I teamed up with Compassion Choices and Connecticut patient Lynda Bluestein to challenge the residency requirement in Vermont's Act 39 law so that patients like Lynda can access the end-of-life care they want. Please listen to Lynda's story.
I have a master's degree in public health from the School of Public Health at UCLA. I had boundless energy and was involved in starting causes, and my license plates said activist on them, and I started a Connecticut Coalition Against Gun Violence. So we passed the first assault weapons ban, and I got involved with a lot of politics and running for office while working in physician medical practice. My husband's a physician, but he, like me, has seen bad deaths. So Paul has been working with Compassion Choices for years, offering testimony. 2019 started with breast cancer, and I had mastectomies and treatment for that. And I thought, okay, I'm done with cancer. And then in May, I was diagnosed with malignant melanoma, cancer number 2. 2021 dawns, and I'm not feeling well. My husband actually took the call, and he came back in, and he was sobbing. His eyes were red, and he put his arms around me. He said, Lynda, it's not your gut. It's your ovaries. You have late-stage ovarian cancer that's already metastasized. And at that moment, in our bedroom, holding on to one another, I realized that this was a death sentence, even though people say, oh, have hope and all that. My mother also had breast cancer. She died in my arms. My mother had leukemia. My mother had ovarian cancer that I didn't know about. I began to say, this is serious stuff, and I have to stop thinking about medical aid in dying as a hypothetical for other people, because I know how this is going to end. This is my new reality. Despite what I thought I could fight with my energy and my enthusiasm for living, I'm realizing that I have to make plans for my life to end the way I've lived it.
Lynda is like so many of my patients who want to live, but whose disease is making that impossible. Having watched both of her parents die painful, lingering deaths, Lynda is very clear about how she wants the end of her life to unfold. I'd now like to introduce Ron Shems. He is the Vermont lawyer on our team, and he's going to explain the lawsuit we have brought.
We brought this lawsuit on behalf of a patient in Connecticut who wants to receive medical aid in dying services in Vermont, but the Vermont statute is limited to Vermont residents. 3 different provisions of the United States Constitution prohibit a state from discriminating against residents from other states. They are the Commerce Clause, the Privileges and Immunities Clause, and the Equal Protection Clause. Those 3 provisions boil down to prohibiting Vermont from discriminating against residents from out of state. That is why we brought a civil rights case here in Vermont to declare invalid the residency requirement of the medical aid in dying statute. The healthcare is more and more of a nationwide or multi-state industry. Here in Vermont, we have great examples. The UVM Health Network serves Vermont and portions of upstate New York. Dartmouth, which is based in New Hampshire, serves New Hampshire and much of Vermont. The services you receive from a medical organization and where you go to the doctor and type of services you're able to receive shouldn't depend on what state you live in. A very similar lawsuit was brought in the state of Oregon last year The state quickly settled with the plaintiffs and agreed that the state would no longer enforce the residency requirement and would seek legislation repealing the residency requirement. The legal issue here is really quite narrow. It's a matter of whether or not a state can discriminate against residents of another state.
I'm very hopeful that Vermont can be one more state that will drop its residency requirement. I'm very hopeful. Losing so much to cancer has been difficult, but losing my agency in how I die and the end of my life is worse. And that's why medical aid in dying is so centrally important to my soul and to my peace of mind and to ending this one beautiful and amazing life the way I want it to end.
At the end of the day, this isn't about lawyers and it isn't about doctors. It's really all about patients like Lynda. Let's make medical care available to people regardless of where they live.